Whether it's a cream, lotion, or serum, retinol is a really popular ingredient in many skincare products. While you may use it on your face, a growing number of products are also targeting other areas of the body. So we have Stephanie Navarro here, an esthetician and laser clinician for Derma Health Skin and Laser here in the Valley. Thank you for joining us.
Thank you for having me.
So I'm pretty sure my co-anchor and I spent about 30 minutes during the commercial breaks talking about retinol this morning because it's kind of hard to figure out what to use, what you should use. How can you help us out this morning?
First and foremost, seek a professional.
Okay.
You want to make sure that you are using something that is appropriate for your skin type. So I brought some examples today of just the wide range of the scale of percentage of retinol. Retinol is going to help with fine lines, redness. It's going to really kind of slow down and keep things at bay when it comes to the concerns that we have on a daily basis. But there's introductory, all intensities. So, I mean, you just have to seek the professional to really match you.
And that totally makes sense. How about let's start over here and kind of tell me what we're working with on this side.
So this one, for example, has a percentage of 1.0. I always tell my patients that it's like going to the gym. I'm not going to pick up my 50-pound weights first when I've never worked out before. I'm going to pick up my 5-pounders and ease into it. I would not start a person who's never used a retinol on a 1%. So again, you want to taper your skin into it. But what does it do? It helps with, again, those fine lines, helps with acne even, it helps with that redness, a lot of common things people struggle with.
And you have SkinScript and you have Skinbetter Science here. This is medical grade skincare, correct?
Correct.
And it tends to be more expensive, quite honestly, than what you would get at the drugstore. But it's the quality that's going to be much different.
Correct.
Okay.
Because if you think about it, these aren't really found at retailers that you can find a lower percentage of retinol at. So these aren't over the counter because the retinol percentage are more intense. So with that, it gives you that longer term result.
Okay. And tell us about what else we have over here. This looks like some glycolic pads?
Yes.
Okay.
So glycolic and retinol. So those pads are going to be a retinol and an exfoliator in one. So we chemically exfoliate the skin. I recommend this to my patients who have that oily, acneic skin, those who are breaking out, kind of struggling with, they don't know what to do next in their regimen. So with that being said, it combines both, which really intensifies that result.
When should you start using a retinol?
After you speak to your professional and they match you with the right percentage on which retinol to use, you introduce it into your regimen starting out at least, like I said, once a week,
okay.
No more than twice a week.
Is there like an age? Because sometimes you see those memes and it's like, if you had a crush on Zach Morris, it's time for you to start using a retinol.
I actually really like those memes. They're really funny.
Right?
I feel attacked a little when I read them.
I know, I'm like, wait, yeah. I'm not that old.
But with that, yeah, I mean, it just comes down to knowing what you're using, and when it comes to an age, not really. It's all skin type, and you have to go with what your skin tells you.
Yeah, because so much of it is also, I mean, genetics. I mean, obviously how you take care of it and the products you use are important. So always a good idea to talk to your dermatologist, no matter how old you are. Anything else you want to share with folks, just as we kind of head into the season where we might be spending more time outside?
Absolutely. All I have to say with the retinol side is don't be afraid to start using these products. Just don't overuse them, which is why at Derma Health, we always tell our patients when they come in, make sure you bring us your products. We can talk through it with you. The first concern I have with patients is product mismatch, and that's what happens where their skin reacts and they're unhappy, and then it gets more expensive later to fix.
Yeah, and I think the idea of retinol sounds scary because you're like, oh, is it going to dry my skin? Is it do all these things? If you're using the right things, you should be good, right?
Correct.
Okay.
Yes.
Cool. Well, we could talk about skincare all day long. It's one of our favorite topics here. So thank you so much for joining us. We really appreciate it. We'll send it over to Pete. Pete, do you use a retinol?
I don't, but you know, it sounds like if I was going to start with baby steps, right? And then gradually ramp up. So